think we have everybody. We'll go ahead and get started. So good morning, welcome. I know most of you, but my name is Kristen Craig, president of the Chamber. I'm glad to have you all here today. We have been talking about doing, well, of course, let me back up. Of course, over the last, 12 months or so, we've done a variety of COVID-related seminars. I've joined many of you on those calls, seen many of you doing different seminars as well. So we felt it was time to do one more kind of educational opportunity for our community, kind of specific to our employers. And so here's the goal for today. I know a lot of you that are on the call are representative of companies, maybe even in HR positions. I'm seeing a couple names. Really in a role where you have a lot of contact with individuals who are now becoming eligible for the vaccine. And as we look at the number of individuals in our community that are taking advantage of the vaccine, I think we could all agree that we'd like to see that be a little bit higher. So the goal of today's session is just to provide you with some of the basic facts and information you might need to know as you go out and are talking to your employee populations and encouraging them to get the vaccine. We'll also delve a little bit into in particular, some ways you can incentivize employees to take advantage of the vaccine whenever they do become available. So we're keeping today's discussion pretty informal. I do have a long list of questions compiled on some general questions about the vaccine itself and about rollout. But if you, anytime during the program today, you have a question, please feel free to submit it via the chat. And we have that up on the screen here, and we'll be able to ask our panelists those questions. So with that, we'll go ahead and jump right in. I would note that we are recording today's session as well, so that we can share it out on our YouTube channel with a few more members that would be interested in the information. So let me introduce our panelists for today, kind of give you a sense of who we have joining us. We have Lindsay Stergar, who is the COO of Terre, Haute Regional Hospital. Thank you, Lindsay, for joining. We have Dan Clevland, who is the System Pharmacy Director for Union Hospital. We have Rhonda Smith, who is the Chief Nursing Officer for Union Hospital. Thank you both for joining. We have Nicole Hall, Nicole, I know you're with Valley, but I think you have a couple different titles. So I'm going to let you introduce your own title. How about that?
Hi, I'm Nicole Hall. I'm a nurse practitioner here at Valley Professionals Community Health Center, but I'm also the clinical director at the Indiana Primary Healthcare Association.
Thank you, Nicole. Appreciate that. And then, of course, we have Dr. Darren Brucken, who I think we all know and have gotten to know quite closely over the course of the past 12 months. I know I've spoken to him a lot, who is the Vigo County Health Commissioner. So thank you, Dr. Brucken, for joining us this morning. So let's go ahead and just dig right in with some of the kind of general questions that we're hearing about the vaccine. Let's start, and Dr. Brucken, I'll just throw this out to you to get things started. Will the shot hurt or make me sick? I think that's one of the things we're hearing a lot of discussion about, especially after that second round of a vaccine.
Yeah, sure. Yeah, it's there are some side effects associated with any vaccine. Soreness at the injection site is pretty common with any vaccine. This is an intramuscular injection, so there's a little bit of soreness there. The side effects are very, very mild in the great majority of cases. Well over 99% of people have minimal to no side effects. The side effects only last about 24 hours. You can get things like headache and malaise, some chills, those types of things, particularly if you've had the illness already and then receiving a vaccine. But a couple of Tylenol doses seems to really alleviate that very easily. So it's a very, very minimal trade-off for the benefits of the vaccine, of course.
I think there's some questions around why we have to get 2 shots and kind of the differences between the types of vaccines. I'm just going to kind of randomly select panelists to answer, but if it's better that someone else answer, please feel free to jump in. So Nicole, I'm wondering if you might be able to share a little bit of information about the different types of vaccines and why the 2 shots in some cases are necessary.
So the 2 shots are for the Pfizer and the Moderna vaccine. Both are mRNA vaccines, which kind of help give your body the recipe to fight the virus. In that, during the studies, they found that 2 doses were needed to get adequate immunity to fight the virus. For the Johnson & Johnson, it's a 1 dose, which is nice and convenient for those who don't want to go back for a second dose. And it's the technology for that differs a little bit. It's more of a viral vector vaccine, more Dr. Brucken would probably definitely be able to weigh in a little bit more better than I am on this one. But definitely, a very adequate vaccine to help fight the virus.
Dr. Brucken, anything you want to add there?
Yeah, no.
Another question, and I'll let you as panelists kind of decide who could answer this one the best.
The Johnson vaccine.
Oh, I'm sorry. You were cutting out a little bit. Go ahead.
All right. Yeah, the Johnson & Johnson vaccine is a DNA vaccine that's encapsulated in an adenovirus 26 virus. So you can't get sick from it, which is good. And it is 1 shot, which is nice. The end product of both vaccine processes is the same. It teaches your body to recognize the proteins that coronavirus carries, has to carry to get inside your body. So that's how it mounts its immune response. So, and those are the 3 vaccines that are available. Moderna and Pfizer are pretty much interchangeable, both messenger RNA vaccines. The reason there's 2 shots for them as well is 1 great big shot can be associated with hyperimmune responses as well. So, and that data dates back a couple of decades where they were able to scale that back for an adequate immune response without causing side effects.
Okay, excellent. Thank you. Sorry about that. I think we had a little lag in our internet here. Maybe I'll toss this out to the folks at Union. Can I pick which vaccine I get? That's a question that we're hearing a lot as people go to sign up at different sites throughout the community.
Excuse me. We're also hearing that a lot. We receive a lot of phone calls. Unfortunately, this time you cannot pick the vaccine you want. Each location is allocated a certain vaccine based on the storage requirements. Like the Pfizer one initially had to be in an ultra cold freezer. Some new data is out now that it doesn't necessarily have to be in that. So each site is allocated a certain vaccine. So at this time, you cannot pick which one you get.
Okay, thank you. Dr. Brucken, I'll throw this one back to you. Does the current COVID vaccines protect against some of these new variants we're starting to hear about?
Well, right now we're really tracking observational data and the in vitro data as well. In the laboratory, it's a lot easier to try to make hypothesis and jump across with common sense type of conclusions from these things. There should be a good deal of protection from the vaccines. We know from the UK variant there's excellent coverage. But the vaccine definitely will provide some benefit. If there are a fall off with the mutations, the variants, yeah, there is. But if you've not been exposed, but people say, well, I already had COVID, how can a variant, reinfect me? And that's where some of the benefits of giving the vaccine to somebody who's already recovered from COVID goes, because you're going to get additional immunity from the vaccines. There should be some benefit there, absolutely.
Thank you. Nicole, I'll circle back with you for just a second. Are there categories of individuals who should not be getting the vaccine at this time? We've heard questions from pregnant mothers, from those who are immunocompromised. Is there anyone that should not be getting it right now?
The only people who should not get the vaccine who are those who have had a severe allergic reaction to the components of the vaccine. Everyone else, that's definitely a conversation to have with your primary care provider, as well as following along with the state allocation guidelines for those who are eligible at this time.
Okay, thank you. Let's go back to our folks at Union. Can you let's go with this question. How long does protection last from COVID-19 with the vaccine?
Well, there's a lot of different opinions on that. Initially, some of the reports I've read were, 3 months is kind of what they quoted initially. Emerging data, because we don't have a lot of long-term data yet, maybe 6 months to 8 months. So honestly, don't know the official answer on that, but that's currently what they're suggesting, from what I understand.
I've heard discussion that we may have to start getting annual boosters for COVID-19. Is that correct?
There is some discussion like with that, and I mean, my long-term hope is they can figure out how to package it in the annual flu vaccine. That would be really nice, and hopefully we can figure that out at some point.
Mm-hmm. You know, that it's kind of a side note, it wasn't on the questions. Lindsay, maybe I'll go with you on this one. It does seem like we have seen a drop in the number of flu cases in our community this year, and I assume that that's attributed to all of our mask wearing and social distancing and those good things. Lindsay, would you agree with that? Oh, you're muted. It wouldn't be a Zoom call if we didn't have to say that at
There
least.
we go. Yeah, leave it to the one who's on Zoom calls all day long to mess it up, so my apologies. We have seen that, and I think to your point, the masking, the social distancing, everybody's washing their hands. There's just a lot more due diligence around the prevention of spreading germs. You know, we saw a lot less head colds and kind of all of those viruses that we typically see throughout the winter. And to be honest, for us as healthcare providers, it helped decrease the burden given all of our efforts were focused on COVID. I cannot imagine if we were trying to deal with the typical volume that we see with influenza and COVID simultaneously. That would have been a heavy, heavy burden on our healthcare system. But yes, you're correct in that.
Okay. Dr. Brucken, let's go back to you for a minute. After getting a COVID-19 vaccine, will I test positive, or could I test positive for COVID on a PCR viral test?
You can, and we've actually seen that. The importance of it. You know, when you have a vaccine and it's designed to give you an immune response to a virus, that doesn't mean you're never going to get exposed to the virus again. What that means is you now have the tools and the capabilities to defend yourself against viral invasion. So in a PCR swab, it's literally a sampling up in your nose. Just whether or not that's inflicting any damage or illness to you is the caveat feature there. So yeah, and we have seen that already with surveillance swabbing. We'll see people test positive even being fully vaccinated, but they feel fine. And that's the important part of this. With the efficacy, the benefit of the vaccine being about 99% in real life, I know they reported 95 and 96%. We're seeing more like 99% in real life world, which is great. But we have seen that both antigen test and PCR test, we're seeing some positives.
Dr. Brucken, let's stick with you for just a minute for this next question. If I've already, kind of two parts, if I've already had COVID, do I need to get the vaccine? And then also, do I need to be wearing a mask?
Yeah, both on both of those questions. So definitely take the vaccine. I know everyone said you need to wait 90 days. You don't have to wait 90 days. So I would encourage people that even if you're recovered and it was 40 now, while you're eligible in the vaccine supply, you will get additional benefit from that. And two, we've seen with antibody studies that the less severe cases of illness, when people say, I lost my sense of smell or taste for a couple of days and then I was fine, their antibody titers, natural immunity falls off very rapidly, as opposed to someone who was hospitalized and spent 4 weeks trying to battle through this. Their immunity lasts a little bit longer due to severity. After you're vaccinated, absolutely wear a mask. We're still really stay mitigated, keep your social distance, wear your mask, because of what Lindsay touched on as well. The question about influenza, all infectious disease that's respiratory borne is a huge benefit from that. And we're trying our best to keep kids in school right now. We're trying to keep employees at work. And people that are on the call that run businesses realize if somebody gets so much as a head cold and a little bit of a headache, the first instance or thought is, oh my gosh, I've got COVID. And now you're missing 4 or 5 days of work. If you're vaccinated, oh goodness, this common cold is now COVID. But stay masked, stay mitigated, do your due diligence with washing hands, stay away from people. It just reaps huge benefits.
Nicole, I'll circle back with you for this one. Do I have to pay for the vaccine?
Oh, no, the vaccine is at no cost to patients. However, as a caveat, an administrative fee can be charged to your insurance company, of which you do not have to foot the bill for if there is no reimbursement there. So it is a free vaccine.
Another question, Nicole, I'll just stick with you for a minute. Are there rules on, which county you go to or where you sign up for the vaccine in Indiana? Does it have to be where you live? Does it have to be where you work? How does that work?
No, you just have to be an Indiana resident to get the vaccine in Indiana. Just going to ourshot.in.gov and pick a vaccine site. We've seen people, I practice here in Clinton, we've seen people all the way from Lake County here as we just started giving vaccines last night. So you can go anywhere that's most convenient for you.
Okay. Lindsay, let's go with you for this one. Will the state run out of doses before I get my second dose?
Ooh, that's a good question. That's a hot topic. No, they hold back 1 dose for every dose given. At least that is what has been shared with us. Every individual state does manage their own allocations, but I believe that to be the practice across all 50 states.
Dan at Union, let's ask you this one. Can you mix and match vaccines?
No, you cannot. Because as Dr. Brucken alluded to, the first 2, they are essentially the same vaccine, but they are structured just a little bit differently. So you need to, if you get the first one of the Pfizer or Moderna, you need to stick with that vaccine. So you cannot interchange them.
So keeping that little card and keeping track of what you received is important.
Correct.
What happens, Dr. Brucken, let's circle back with you on this one. What happens if you get COVID in between your first and second vaccine shots? I know it's possible.
Yeah, and it's happened. It's happened here in our county several times over. As long as your second vaccine dosage administration date does not interfere with your quarantine, you should still go with your second shot. There's no other reason to not go and get your shot. Now, the Moderna vaccine is 28 days in between shot 1 and 2 and 21 for Pfizer, but that is extended all the way to 42 days. Okay, so you can, if it says, oh, it's going to fall right in the middle of my quarantine or at the tail end, that can be shifted and moved. And you can move your appointments through Zotec, or you can visit wherever you were going to get your second shot, give them a call and say, hey, can you please move my appointment 6 days or whatever. But when you do go to get your shot, you need to be masked and allow, inform people around you, hey, I did test positive. I'm going to probably feel fine, but that'd be the only reason.
Okay. I'm going to go ahead and start to transition into some of the kind of employer-specific questions, but if there's still general questions about the vaccine that anyone has, please feel free to pop those in the chat at any time, and we'll be happy to answer them. So some of the questions I really wanted to address today for the employers on the call. Dr. Brucken, let's just start with you again. How can I help my employees get signed up for an appointment? This is mostly online appointment scheduling, correct?
Correct. Yeah, it is online. And some businesses have already taken contact the Sears Clinic right now, which will be shifting gears next week. We're going to be moving locations, and also through Lansbowne there at Union, to be able to work with the local folks here to try to set up some things. I would encourage employers to send out feelers, number one, to find out how many employees are going to take the vaccine or are interested in taking the vaccine, and do they need help. The younger work staff that have no technical difficulties and things getting online, the Zotec platform is easy. It's not hard in the least bit, as long as they have access. The reason I would suggest employers reach out to their employees to kind of poll them to see what they're going to take. We have seen a very, very paltry response in some instances, where you may get 25% of employees saying, yes, I'm going to take the vaccine. And from an employment standpoint, you want your employees to take the vaccine, because that's going to cut down your work absences, obviously COVID within your business itself. So if you're already noticing preliminarily that there is a minimalist, be a call to arms for the employer themselves to go out and try to educate their employees, to gather more information, to say, this is safe. We're going to provide you with the right information, the right encouragement, and in some cases, the right incentive to get the vaccine.
I'm gonna throw this out for any of our panelists that might have an answer. I was on a call with some chambers from around the state, and they had mentioned that some of their large employers were signing up as vaccination sites. Is that something that is possible through the state? Does anyone have an answer to that question?
I actually, I spoke yesterday on our local health department call about this issue. Right now, the vaccines are allocated to a location. We don't have the ability or the authorization yet to go out on site. And the thoughts or the ideas that came to mind were if we started to stockpile some vaccines, particularly with J&J allotments, can we take those on site as a possibility? So that is in the works. We also have a homebound program that we're trying to put in place right now for folks that can't, get out to a clinic to become vaccinated. So that is a common thought, a common question. I would say, there's a 50-50 chance or better that will happen at some point, but the logistical dynamics to it have not been laid out yet.
Okay. Nicole, let's circle back with you for a minute. If you have an answer to this question, have you heard or have examples of good ways that employees are incentivizing their employees to get the vaccine? And I guess I would say I'll have Nicole go first, but if any of our panelists have an answer to this question, I'd love to hear from you.
So yes, we've had some health centers across the state who, early on, of course, your health care providers were the ones who were eligible first. So at those health centers, they've, developed buttons that said, I got my shot, or I got my shot for, whomever they chose to put on there. Also some drawings, some giveaways, some gift cards, things like that. Just knowing that your employees have the option right now, but then incentivizing them with, PTO or things of that nature are what we've seen already.
Anyone else have anything to add? Creative ways of incentivizing employees that they've heard about?
No, to Nicole's point, we've kind of done a similar thing. We have a weekly dashboard that we send out to all of our employees. And at our clinic, we've given probably about 25,000 vaccines now, either first or second doses. So we put that out in front of employees. We've given this many doses. Reactions have been minimal, if hardly anything at all. Those kinds of things, that it is safe, it is effective, and try to encourage them with showing them overall numbers for our organization.
Next question I kind of throw out to any of the panelists, and I know it's got some legal implications as well, but can you, as an employer, can you mandate your employees to get the vaccine at this point?
This is Lindsay. I'll just say, that's a politically hot question, as you alluded to. No, because it's not mandated on a federal level. It's not mandated on a state level. It is obviously up to each individual employer how they interpret and follow that. I know our hospital system, it is certainly not mandated, and neither is the influenza vaccine. And so that it kind of goes back to the employee's rights, but that's a tough question to answer right now.
Yeah, for what I know as well, it's not legal to force somebody to take a vaccine of any kind, or to base their employment or even scheduling on a vaccine requirement.
Are there any other kind of general considerations you'd like to mention to the employers on the call today as they're talking to their employees about the vaccinations, and how, again, kind of back to, you can't mandate, but strongly encouraging?
Yeah, I'll jump in if that's okay. I think when I speak to the general public and I hear questions from people, there's so much misinformation and skepticism that circulates around vaccines in particular. Obviously this ramp up to this pandemic has been unprecedented, of course, as far as speed and the rollout and the well-publicized troubles that we've had logistically with getting vaccines to people. I encourage people, go out and find good information from good sources. Don't rely on hearsay and the rumor mill, you know, addressing things like pregnancy concerns and Bell's palsy, everything that came up originally, and altering your DNA, all of these types of kind of myths that are out there. You know, encourage your employees, you know, provide them, do the job yourself to provide them with good, solid information. You know, give them the handouts that are published by the CDC, or at least make them available to them, to keep them from hitting the Google search and figuring out, oh my gosh, is my grandchild going to have autism in 2037 because I'm getting this shot today, type of thing. Because it does help. And every time I've had the opportunity to sit down with people that the science of the vaccine, the safety of the vaccine, the background of the vaccine, invariably they say, yeah, I'm definitely going to get it. I see the benefit now. And remember too, that the people in the general public, you know, we're all healthcare providers, so we have seen the devastating effects of the vaccine because we're taking care of these patients. So we see that, and from a public health standpoint, you know, we trace through there, we hear about who is sick and who has died and who is still in the hospital and who's on a ventilator. But the guy working third shift at an assembly line may not have that in his life. So they don't understand the healthcare concerns, the morbidity and the mortality impact of this. But you got to keep that in mind when you're addressing the audience as well.
I would mention that everybody who signed up for today's seminar, we're sending out a packet of information to you all. The CDC, as Dr. Brucken mentioned, has some really great resources, just some, you know, one-page flyers that you could print and hang on doors throughout your company, or distribute to employees via email. Just really quick, simple to understand information that you can be pushing out there to your employees. So we're going to get you a packet of information that includes a lot of that type of thing. So again, you can, you know, do your part in helping out and encouraging everyone to feel safe and, you know, go out and get their vaccine whenever they're eligible. I'm not seeing any questions popping up in the chat. I think we've covered a lot of the topics that I had on my agenda. Is there anything else before we close out that any of our panelists would like to add to the conversation? You know, anything we haven't covered today?
I think one important thing for employers to remember is that when somebody has been fully vaccinated, that they've gotten their second dose, if it's the mRNA vaccine plus their 2-week period, if they are exposed to a known positive, they do not need to quarantine. So if their family member, for instance, if a wife gets it at home, then the husband does not have to quarantine. So they don't have to miss 10 to 14 days of work, which is a huge benefit from an employment standpoint. And the same goes if you have, you know, an assembly line type of thing and somebody gets COVID, comes up and test positive, the people around them, if they're vaccinated, they don't need to quarantine if they're vaccinated. If they are not vaccinated or not fully vaccinated, they will be subject to quarantine. Right now, the CDC has that extended for 90 days. It will probably extend beyond that once the observational data from Moderna and Pfizer comes back through to extend that even further, particularly in the younger workforce age. And then the state yesterday dropped down to 45 plus. It's dropping to 40 plus today, supposedly. And then after that, we're going to see a fall off in the amount of the percentage of age groups that take the vaccine likely. So we should start seeing larger jumps. So the next group might be 30 plus. The next group might be 25 plus, and trying to get, you know, folks vaccinated.
Any of our other panelists, any final thoughts you want to add?
I think I'm okay.
Well, I just want to thank you all for joining us, and in particular, thank the panelists. I mean, this has been just an incredible year. Just, you know, thinking as we kind of hit that anniversary date of our quarantine, I was thinking about all the changes that we've had over the course of the past 12 months and all the things we've learned, and it's just incredibly hard to process. So I just want to extend the biggest thanks possible to all of you in the healthcare field and everything you've done over the course of the past year. You know, we've talked about this before, so proud of our community and the way everybody has come together and really helped tackle this issue head on. And as we roll into the vaccinations being eligible for more people, I think we just have to continue to keep tackling it as a group and keep informing people to get out there, get their vaccines. This is safe, and answer those questions. So thank you all for being willing to do that this morning. As I said, this has been recorded. We will be putting it on the Chamber's YouTube page. So if someone you know was not able to attend today, you can feel free to jump on there and send them the link and hopefully get some of their questions answered. So again, thank you all. Thanks to all of our attendees for being here today, and go out and have a great day. And don't forget to get your vaccines if you haven't already and if you're eligible.